Cortisol from mouth all the way to the end depletes the protective mucus lining that we have in our gut, which is where 75 to 80% of our immune system lives.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast. Today, we're going to be starting a new series on gut health. I've been noticing a lot of Medscape articles, a number of different things that have been coming out that are shedding more light on gut health, and it's tied to the immune system, cortisol production, a bunch of different things that was obvious to me because I learned it in medical school. And it seems like there's a lot of new research that's just catching up with stuff that is already known or kind of confirming stuff. So I wanted to bring on a special guest to discuss the importance of gut health and how it ties to just our overall health in general. For this particular series, I brought on Dr. Michelle Retz, who's a naturopathic physician, and she is the faculty at the Southwest College of Naturopathic Medicine for Gastroenterology. She's been in practice for 11 years, and she recently joined our team here at Ethos Integrative Medicine. So Dr. Michelle, welcome to the show.
Thank you so much for having me.
So we're going to be diving into gut health as a whole. And, just like with most of our series, I wanted to give a brief overview of what gut health entails. It's a term that I think a lot of people hear quite often, and we may not always know specifically what we're talking about when we're referring to gut health. So you kind of have this breakdown of at least 6 components that gut health entails. And so I'd like to really cover those today, and then we'll be diving into those in addition to a few other topics throughout this series. Before we start that part, though, why don't you go ahead and kind of give us a little bit of background about yourself, what got you into being a naturopathic physician, in addition to what got you wanting to focus in on gut health?
Sure. Well, I've been blessed that since a very young age, I've known that I wanted to be a doctor since I was 8. So, I was like astronaut, teacher, doctor, we're done. So my mother was an RN. I'm like a really good nurse, really caring, empathetic person. And my father was a corporate CPA, and then he bought a medical transcription company. And when I was 11 or 12, he let me manage the payroll for a few bucks.
Yeah.
So I was kind of around medicine. I would read my mom's RN magazines, like look at the gory pictures. I found those fascinating. I was checking out her Grey's Anatomy. I would watch surgery on PBS. They used to show it on TV.
Not know that.
Really intense, inappropriate surgeries. And I was fascinated, just fascinated with the body, and the fact that we don't break apart every second just is amazing to me. So I kind of knew that I wanted to do something in terms of healing, and doctor was it. So my trajectory, was to be a doctor. And as I got older, I think I didn't know about naturopathic medicine. I'm from Ohio. Go Buckeyes. And I wasn't familiar with this integrated natural allopathic kind of version. So I just was like, well, I'm going to be a cardiothoracic surgeon. That's the best of the best. The heart, the lungs, the center of the body, the most challenging. I want to tackle that. I think that would be interesting. And my, junior year in high school was when insurance companies really started to dictate the face of medicine, and the flavor of medicine started to change. So they weren't reimbursing doctors very much. They were saying, no, you can't do that MRI. You don't have permission to do that CT. And the physician was no longer in charge of the patient's care, and their hands were being tied a little bit. So they needed to see 40 to 60 patients a day to make up the overhead, or they were closing their practices because they couldn't make it. And the visits became really short, 6 to 10 minute follow-up visits, lack of eye contact, stress doctors. The feeling was really different. And I have wanted to do this for so long, I became very worried. I did not want that flavor of medicine. And I had friends who were graduating from college, entering into the med program and really not liking it and owing $250,000. And I was scared.
Yeah.
Honestly, and I hadn't heard of naturopathic medicine, so I just took a minute to say, what are my options? I don't know if I'm comfortable entering this paradigm. I found naturopathic medicine, Southwest College of Naturopathic Medicine here, and holy cow, here's a medical program all year long, same set of, boards and, licensing and residency and all of that, plus all the natural stuff, So I fell over and then jumped up and down for like 20 minutes. And I was like, this is it. This is what I'm doing. I was doing half of this natural stuff on my own to myself anyway. I was really interested in Chinese medicine and Ayurvedic medicine and herbs, and I was vegetarian, and so it was a really natural fit for me. So that's how I got introduced to naturopathic medicine. I took a year off between college and med school just because I knew once I got the ball rolling, it would never stop.
Smart, yeah.
Yeah.
I did not do that.
That was really good. So I got to delve into a whole lot of other stuff, and plant some seeds that would sprout later, which was really great. And then I came out here, went to med school, did residency, and started practice the month after my residency was over. And I continued to teach at the school. I love teaching both in the classroom and then in the clinic is very different. So I had rotations where students would shadow me and learn how to do our medicine and learn, how to treat patients and learn the modalities. But then I would teach in the classroom I taught advanced women's health courses. And then, about 6 years ago, there was kind of a changing of the guard at the college. Very important, well-known physicians were kind of stepping back a little bit. Mona Morstein was one of them, and she was the nutrition chair at the school. She was my mentor during residency, and she still is today. She has unparalleled knowledge. In general, as a naturopath, a really good holistic naturopath, but specifically with regard to nutrition and gastro.
Yeah.
There are giant shoes to fill. And I think the whole community was like, oh my goodness, how are we going to fill these shoes? And I don't know that anyone could answer that question wholeheartedly. But I personally, wanted to take charge of the gastro part. I just felt like GI health in general is fundamental to how we work. Everything you take in emotionally, your food, your vitamins, your supplements, everything, how well you digest that or absorb that is the rest of the story. How healthy your army is and protects you against infection. It all starts there. And I was really lucky to have had her teach all of our classes. And I really mother-henned that class, so to speak. And I wanted her permission to continue to teach it because I was concerned that someone else who didn't have her teach them potentially or came from another paradigm might not continue to share that information. And I really think it's a pillar of good naturopathic medicine. So I got her permission to carry the torch for the class. And so I've been teaching it for the last 6 years, gratefully.
Yeah.
I really love GI health. I'm really passionate about it. And so, I continue to teach that class today. So that's how I kind of came into the gut part of it.
Yeah, that's awesome. And you're right. When we're looking at our field of medicine, the GI system is such a huge component of what we do. Obviously, I'm going to have a little bit of bias, but I honestly think we do, as a profession, we do a really good job at addressing the concerns that fall within gut health. I was the last class that was able to be taught by Dr. Morstein, so it's nice that it's been passed on to someone that is worthy of being able to teach that course, because I know, like you said, she's such an important staple within our profession, and just a fantastic teacher. That was one of the things that when we found out we were the last class that were taught by her, we were kind of like, well, crap, I don't know who's going to be able to really pick up that torch and do as good of a job. And so I'm glad that it was you that took it on, because, like I said, that it is a fundamental part, and it's such a bread and butter of our profession as a whole and what we can do. Let's dive into really looking at the different factors when it comes to gut health. I mean, obviously we have different GI concerns that can exist, but let's really find a way to categorize them just to make it a little bit easier for our audience to understand at any given point what we're talking about. When we're looking at GI health as and I guess one of the first components or one of the first factors, you had mentioned that one of the biggest things is going to be digestion, right? So talk to me a little bit about what we mean when we talk about digestion as a whole, and then we'll kind of dive in from there.
Sure. Very first thing is what happens when you put food in your mouth and how well you break that down so that the body can take it in. So it starts in the mouth. You make enzymes even in your saliva. So as well as your, even if you have another condition that compromises your ability to produce saliva or a medication that dries you out, it's going to affect your ability, right, to digest your food. How well you allow food to come into the stomach. There's a doorway between the esophagus and the stomach. If it's too tight and it doesn't want to open, that causes some problems. If it's open all the time and it doesn't close, that also causes some issues. Like heartburn and GERD. But normally, if food just comes into the stomach, we need good amounts of stomach acid to break that down. And that really is the main signal that starts the entire digestive process. Aside from seeing it, smelling it, and starting to chew it, the biggest thing is acid production. It's the pH lower, it lowers the pH, and that gets everybody set below the pancreas, the gallbladder, and the small intestine. It's like, all right, everybody, get ready. Here it comes, right? But you've got to make enough to make a change in the mixture of what you're mashing up so that everybody is aware that something's happened and they know, oh, it's really acidic in here. We need to put out some bicarb, and that means we need some enzymes. There must be some food. And then the wall of the intestine gets ready to chew up the little bits of food that come in. And the gallbladder's like, well, there's probably some fat in there. We should probably put out some bile. Everybody it's a coordinated effort, right, to really digest this piece of food into some nice, really fine mush that then the walls of the intestine can absorb. And the small intestine is really where we absorb most of our stuff. We've got good flora there as well that's going to get fed a little bit, but we don't want to overfeed, and we don't want to feed anybody who shouldn't be there necessarily. So that's why digesting, right, breaking it down so we get to take it in is our number one priority. And the body really wants it well digested. It doesn't like big chunks of food coming in. It doesn't do well if the stomach acid isn't there, or the enzymes or the bile. It sets us up for so many processes down the way. We're kind of militant in the sense that our army is really picky about who we let in and when. And they're really in charge of you don't come in until I say you come in. It's Tuesday at 10. It's 9:59. We're not ready for you, but that's to our benefit, right? That's to protect us. So it's in charge of, I say you come in, you're my friend. You don't get to come in, you're my foe. And so, a good gut has a great army, a really tolerant but picky army, good walls, good borders, good acid, good pancreatic enzymes and bile, and good motility, good peristalsis, how we squeeze everything down, healthy musculature, a good nervous system that works very well to move things down the line. And we should be stimulating things in the large intestine when we eat to sort of have a bowel movement. When we're making room for food to come in, we want to have things come out, right? So there's a healthy rhythm and a healthy movement to all of that. Our food should always nourish us. It should feel good to eat food. It shouldn't cause pain, discomfort, bloating, belching, gas. It should move. It shouldn't sit still. And we should feel satiated by it. We should have a healthy appetite and be able to eat 3 times a day, but we should also be able to be full, right? And listen to our body. We should never feel like I just ate all this food and I'm still ravenously hungry, like I didn't absorb it. We should be full and we should feel good, and satisfied by our meal. It shouldn't cause us any pain or discomfort. That's probably, the overarching umbrella, I would say, of gut health.
So you discussed digestion, absorption, briefly movement, gut flora, obviously, or your army, as you mentioned. I love the way you put that. And you have 2 other things that you really look at when it comes to gut health that I think will often go missed by most doctors, and that's happiness and stress management. Can you kind of talk a little bit about why those are important to, when you're looking at gut health as a whole and how you kind of assess that?
It's going to sound cliche.
Yeah.
To talk about stress.
Yeah, for sure.
But it always matters. And from, a naturopathic or a holistic perspective, it probably matters the most. How you live, how you love, and how you're managing what's happening in your life. Stress is the perception you don't have the resources to deal with what's happening to you. It doesn't matter what it is. So whenever you're in a stressful state, your cortisol levels rise. That's your hormone that says, oh, there's a bear, we're going to die, run. Yeah. That's the message to the body whenever we're stressed is it's survival mode, fight or flight mode. It could be your boss, your wife, rush hour traffic. It doesn't matter. It always feels like there's a bear and you're going to die and you need to run. And so the body's fantastic at getting you ready for that response. And if we're staying there for a long time, got a long project or a really bad environment, relationship, whatever that is, our cortisol levels are just high all the time. Cortisol from mouth all the way to the end depletes the protective mucus lining that we have in our gut, which is where 75 to 80% of our immune system lives. Yeah. So you could see that might be a problem.
Yeah.
So depleting your army just sets you up for infection. So things to get across the border that wouldn't have gotten in there, large pieces of food to get across the border that would not have gotten in. And that can set you up for food sensitivities, food allergies, infections, and other issues. All the background noise of whatever you might perceive stress to be wholeheartedly affects how you absorb, how healthy your immune system is, and then how you're living or loving. When we look at the gut, aside from a digestive perspective, it's how we take in everything, how we receive, even emotionally. You'll find people use, comments like, oh, he hit me right in the gut when he told me that news, or I'm so anxious, I feel butterflies in my stomach. I mean, that's serotonin that we're making, but it's in our stomach. There's a real emotional connection to the gut.
Yeah.
Very much tied to how you receive, whether it's compliments, things you believe about yourself, how you receive news, and what you're holding on to. You'll often find if people aren't speaking their truth, creating healthy boundaries, being honest with themselves or others, and they're retaining or suppressing things, their body will be a mirror for the same thing. So we can see constipation, physical constipation, and emotional constipation happening. We can see verbal diarrhea and physical diarrhea, right? These things are intimately tied together. There's a huge mental, emotional component. The gut is said to be the second brain of the body, and the heart would probably be the third. But there are as many neurons in the gut as there are in the brain. It is an independent organism that is intimately tied to the nervous system and the rest of the body, but it can function on its own. And very often, I think we're not tuned in enough to understand how it actually is. And when we stop and take stock of making that connection mentally and emotionally with what's going on physically, it can be life altering.
I agree with that. And, I think when we're looking at just the gut health in general and the stuff that you talked about, you can get into, again, it's cliche to talk about stress. I think especially in our realm of medicine, it can be cliche to talk about happiness and stuff like that and emotional stuff and all that. But I mean, there really is a tie to it. And I love the example that you used of, you receiving news and it's like you felt like you had like a gut punch, or you're anxious and you feel the butterflies. I feel like a bunch of people have realistically experienced those things, and it just proves that there is, regardless of how like out there you think stress management or whatever it is, or how unimportant it is, it just proves right there that there is a correlation with the two. I like that you really look at understanding those two things when in addition to tying it into just all the physiologic aspect that conventional medicine and traditional medicine will look at as well. With the exception of gut flora, I don't think that's not necessarily looked at super well in that world. But you obviously do a great job of looking at that, and we'll kind of discuss that. Some of the special topics we're going to be talking about within this podcast are going to be cortisol production in the gut, as well as your gut health and how it correlates to your immune system, as well as food sensitivities. And then we're also going to be breaking down a lot of concerns that people have, common concerns that Dr. Retz has seen with regards to like heartburn, IBS, SIBO, constipation, a bunch of different things that people experience every day. They may not talk about because, talking about your gut health sometimes can be a little taboo for people.
A little embarrassing.
Yeah, a little embarrassing. Someone that has like, excess bloating, belching gas, stuff like that. Let's just break through that barrier right now, and let's discuss, to kind of wrap up this episode and just to give you an idea of some of the things we're going to be learning. Let's discuss, like poop and stool. This is something that I know you chat about with all your patients. Mm-hmm. It's something that is, again, can be taboo to chat with, but I think if we just break through this barrier, we'll be able to get through the rest of this series, no problem. So let's just rip the Band-Aid off here. Let's discuss when we're looking at gut health. You talked about earlier what was normal. You shouldn't have pain. There shouldn't be excessive belching, gas, all this other stuff. Talk to me about what normal stool looks like, and then what can happen with your stool and what information does it give us about your health? Because it actually does give us a lot of information if you're able to, just turn back around for a second. Yeah. And so
exactly.
Walk us through that, please.
Sure. We have to start with the culture. You're saying, you come to me with a toenail issue, I'm going to ask about your poop and your emotions. So it all matters. But changing your culture at home, whether it's with your little ones or just your own self and your awareness of it's the easiest marker to look at how your digestive system is doing is what's going in and how is it coming out, right?
Yeah.
You should have a bowel movement at least once a day. Ideally, 2 or 3 times a day. If you're eating 3 meals a day, there's a reflex called the gastrocolic reflex. When you bring in food, it should stimulate things down in the lower bowels to 1 want to come out. So we make room. So ideally 2 or 3 bowel movements a day. They should be well-formed. So like a sausage, probably, a tube-shaped, well-formed, not very loose or runny, not really hard. You should not strain to get it out. It should come out easily, and it should feel complete. It should be satisfying. When your dog runs around after a bowel movement and he feels so good, and he's like, yes! And he just runs in circles for 30 seconds. That's how good it should feel. He just lightened his load. He feels great, right? It's awesome. Satisfying, right? But it's genuine. I mean, that's, it's genuinely true.
It's not taboo for them.
Not at all. It should be brown, just a normal brown color. There should be no undigested food in the stool other than corn. Corn is normal. There should be no blood or mucus, and it should sink to the bottom of the bowl. And so when we look at variations in that, it's really giving us information about, what might be off if it doesn't look like that. So if it's, we'll talk about constipation and diarrhea. There's a whole host of things you need to consider when you're experiencing one or the other or both. So those will be different topics. If it's not brown, if it's tan or yellow or grayish, that means you're having an issue with bile. You're not making enough bile, or it's not getting out into the bowel to help you digest your fats. And so there's an issue with your liver or your gallbladder. Usually probably with the gallbladder, could be gallstones, could be thick bile that's not really getting squeezed out very easily, and you're not digesting your fats very well. If there's any food in the stool other than corn, so you're seeing grassy bits of vegetables, lettuce, tomatoes, peppers, whatever, anything else other than corn, that shouldn't be there. It either means you're not making enough stomach acid, you're not making enough pancreatic enzymes, and you might not be making enough bile. So there's something going on way at the beginning. You're missing out on nutrients, and all this roughage is kind of coming through all the way to the end. If the stool floats on top of the water, it's an issue with there's extra fat in the stool. You're not digesting your fats, and the fat is floating to the surface. Again, an issue with liver or gallbladder, usually with bile. It could be that the pancreas also is not making enough lipase, which is the enzyme it uses to break down the fat. So we'd look at supporting gallbladder or pancreas there. If there's blood in the stool, that gives us information depending upon how much or what color it is. So if there's a little bit of bright red blood, it could be pinpoints on the toilet paper or just a tiny bit on the stool. It could be, if you're constipated, just that the stool is stretching the tissue, and that's causing a little bit of bleeding. There could be a little polyp. There could be a little bit of hemorrhoids, whether they're external or internal. It could be a little cut in the tissue. The bright red blood means the bleeding is closer to the end of the digestive tract, and that's fresher blood. If it's black or tarry, or it looks really black in the stool, it's bleeding, but it's coming from higher up, usually in the stomach or the small intestine. So that can be inflammation. It could be from something like Crohn's, or it could be from an ulcer or anything else that could cause a little bit of blood, but it's much higher up. So where it is, depends on the color, basically, of how it comes out. Let's see. It shouldn't hurt to pass a bowel movement. Like I said, it should feel good. So if there's straining, potentially, that could be that it's more of a constipation issue. If there's cramping or pain before and you feel better passing the bowel movement, it could be that there's toxins that are in there that are uncomfortable and cause symptoms as they pass. Could be more of like an IBS kind of symptom. Usually it's either food or a toxin in there that the body is feeling as you're actually passing it, and it's happy to get it out. Mm-hmm. So that's pretty much, I think those are the basics on the stool.
Yeah.
So take a peek, be brave, turn around, take a look. Your stool is telling you so much information, and we'll go into all those other issues on other topics, but that's kind of a good breakdown on what your poop is telling you.
Yeah, absolutely. And a lot of information just to be taken from that. Again, just wanted to rip the Band-Aid off. Let's get rid of the taboo aspect of it, and then we won't be embarrassed about talking about anything else for the rest of the podcast. On the next podcast episode, we're going to be diving more into digestion, what some issues with that looks like, and then some of the considerations when we're looking at obviously getting those treated and ideally fixed. We'll go ahead and wrap up this episode. Dr. Retz, thank you so much for being on this podcast.
My pleasure.
And we look forward to continuing the series. And everyone, thank you for listening, and we'll catch you on the next episode.
Having issues with low energy and staying mentally sharp? Your hormones can play a role on how much energy and focus you have throughout the day. Our team at Ethos Integrative Medicine loves working with busy individuals who want to feel their absolute best and get the most out of life. Ask our team how you can get more information to learn about our unique approach to hormones so you can continue to take on the world.